welcome everybody to SafeScript New South Wales, what real-time prescription monitoring means for you. Painaustralia is proud to present this Zoom meeting as part of Pain Awareness Month. I begin by acknowledging the traditional owners of the land on which we're meeting on. For us here in the ACT, it's the Ngunnawal people. We wish to acknowledge and respect their continuing culture and the contribution that they make to the life of this city and to our region. We'd also like to acknowledge and welcome all other Aboriginal and Torres Strait Islander people who are attending today's online event. Well, SafeScript New South Wales is part of a national rollout of the real-time prescription monitoring program. New South Wales is developing a computer software system that allows prescribers, doctors, nurse practitioners, dentists, and of course, pharmacists to access real-time information about patient prescription history to help prescribers and pharmacists to make safer clinical decisions about patient care. Painaustralia appreciates that opioid harms and overdoses have risen in recent years and that the recently introduced restrictions aim to address some of those harms. But for people living with pain conditions, medication is often the most accessible and affordable form of treatment and one important component of managing pain. It's important that we achieve a balance between appropriate use of medicines and a reduction in harms. The rollout of real-time prescription monitoring across Australia is an opportunity to do both of these things. While aiming to reduce medication use, if implemented well, this system will be a valuable tool to find the right pathways for consumers, enabling them to better use the medications they're taking. It could also enable a conversation about medications with health providers within a holistic management approach. As part of the implementation of SafeScript in New South Wales, Painaustralia is pleased to be able to provide feedback on the messaging from a consumer perspective. This follows an extensive consultation undertaken by New South Wales Health with health professionals, consumers and stakeholders. We've consulted our consumer advisory group and they agreed that sensitive and respectful communication that emphasises the safety and efficacy of medication use is the key to responding effectively to the needs of patients who may be at risk of harm from prescription medicines. And this is reflected in all of the messaging for this program. I'm pleased to have three different perspectives for the webinar today to talk about SafeScript New South Wales. Andrew Hargreaves from New South Wales Health will provide an overview of the SafeScript New South Wales program. Dr. Chris Hayes will outline how SafeScript New South Wales will work from a prescriber's point of view and how it will affect patients who rely on medication to manage pain. And Kim Allgood, who will describe how SafeScript New South Wales may affect consumers who rely on medication to manage chronic pain. To all of you online, you're welcome to put forward any questions you may have to Andrew, Chris or Kim after our presentations. If you'd like to ask a question, please do so by typing the question in the Q&A function below on your screen. Now I'd like to invite Andrew Hargreaves from New South Wales Health to give the first presentation. Andrew Hargreaves is the Program Manager for the New South Wales Real-Time Prescription Monitoring Program. He's a clinical pharmacist with experience in a wide variety of acute care settings, including critical care and acute pain management. In recent years, Andrew has been working with eHealth New South Wales to enhance the safety and quality of the clinical software systems used in New South Wales hospitals. Welcome, Andrew.
Thanks very much, Carol, for that introduction, and thanks for agreeing to host us here today. Thanks for the patience. So I too would like to acknowledge the traditional owners of the land that we're meeting on today. For me, it's the Bidjigal people in the southeastern suburbs of Sydney. And it's really great to be here today to speak with Painaustralia and your stakeholders about SafeScript New South Wales, a really exciting program which has great opportunity to help reduce harm and try and find that balance that you were talking about, Carol. So what I'm going to cover today is an overview of what SafeScript New South Wales is, why it's being introduced and why it's a New South Wales government priority. I'll cover what medicines are being monitored in the system and who has access to it. We'll talk a little bit about how your privacy is protected. We'll talk about how your health practitioners can use and access the information in SafeScript and how they can use that to support your safe and effective care and the types of support that we're making available to health practitioners and consumers. And we'll also at the end show you where you can go for some more information about SafeScript New South Wales. So SafeScript New South Wales is a computer system that will enable prescribers and pharmacists to access real-time information about your prescription and your prescribing and dispensing history for a certain subset of high-risk medicines, such as opioids and benzodiazepines. It's really important that your prescribers and pharmacists know what medicines you're taking, because some medicines taken in high doses or in combination can be harmful. And we know, sadly, that the harm associated with these medicines is large and it's increasing, and it's really important that we take some steps to address that. Having access to the information in SafeScript New South Wales will help your health practitioners make safer clinical decisions about your care. Hunter New England and Central Coast regions will be the first in New South Wales where health practitioners will have access to the system as part of a broader statewide rollout. That'll occur later in October of this year, and then the rest of the state will come online over the course of the next 6 months. And all prescribers and pharmacists across New South Wales will have access by the middle of next year. So we know prescription medicines can provide relief from pain, from accidental injury, from pain associated with surgery, and the symptoms of anxiety and sleep disorders. We know that, and that's important. We also know that some prescription medicines can cause dependence, and they may become harmful over time or when used in combination. It's really important that your prescribers and pharmacists have access to that information so they can make better and safer clinical decisions and help to reduce that harm. And as I said a moment ago, we know that harm is increasing, and sadly, a large number of people across Australia unfortunately die each year as a result of overdose or misuse of medicines, and that is why New South Wales government is introducing SafeScript New South Wales as part of the broader national real-time prescription monitoring program. SafeScript New South Wales is part of New South Wales government's commitment to reducing harm associated with monitored medicines use, and it sits alongside other programs such as the Take Home Naloxone program and the participation in other medicine scheduling decisions to help reduce harm associated with these medicines. New South Wales government supports national RTPM, and we're working with other states and territories to progressively connect the systems in New South Wales, Victoria, and other states and territories, so that information can be shared across state borders, enabling a national approach to RTPM. Many of you will be wondering what medicines we monitored in SafeScript New South Wales. So this is a list of the medicines that will be in there. I don't intend to go through them one by one, but broadly speaking, opiate pain medicines will be included. Benzodiazepines were used for sleep and anxiety. Other sleeping aids like zolpidem and zopiclone, which are increasingly being used as a substitute for benzodiazepines. Psychostimulants like dexamphetamine, methylphenidate will be monitored, as well as a couple of medicines on the fringe like ketamine, pregabalin, quetiapine, medicines we know that are increasingly used as neuromodulators for pain. And we know increasingly that when used in combination with opiates can be a cause of harm. And then any other Schedule 8 medicine that's not listed above will also be included in the system. There's more information available on the SafeScript New South Wales website about the medicines that will be monitored, as well as the framework that was used to determine which medicines were included in the system. And New South Wales government and New South Wales Health will continue to monitor for signs of adverse effects and harm associated with other medicines and consider them for inclusion in the system over time. So who has access to SafeScript New South Wales? So all prescribers of monitored medicines and pharmacists in New South Wales will be able to access the SafeScript New South Wales system. We're expecting that the largest audience and largest users of the SafeScript New South Wales system will be in primary care. So that's general practitioners and community pharmacists. However, all prescribers will be able to access the system. So that includes specialist practitioners like pain specialists, as well as nurse practitioners working in pain in emergency departments and so on. Dentists will also be able to access the system, as we know that in some circumstances, dentists prescribe medicines for pain and anxiety associated with the care they provide. Your privacy is protected, and the records that are kept in SafeScript New South Wales are secure. All health practitioners, in order to access the database, need to be able to demonstrate that they're registered currently with AHPRA. They're registered health practitioners. We go through an authentication process to ensure that people are who they say they are when they register for the system and create their username and password. They'll also each day need to undertake a process where they verify who they are by using not only their password, but also an additional PIN number sent through to their registered mobile phone number. So that connects them, and that ensures that that they are who they say they are, using that multi-factor authentication technology that many of you would be familiar with, like when you use when you interact with your bank. And then they'll set up a daily PIN number, which only they know. So that's how we can be sure that only the people we want to see the information in the system will see the information in the system. Over and above that, only prescribers and pharmacists involved in your care are permitted under law to view your information. And there are penalties under law for unauthorised use or disclosure of the information. In addition, authorised officers within New South Wales Health will also access SafeScript New South Wales as part of their regulatory work in ensuring the safe supply of medicines in the community. So how will your health practitioner use SafeScript New South Wales? That depends on the circumstance and the care setting that they're involved in. But if we consider general practice and community pharmacy, which is probably the most common, health practitioners will receive clinical notifications in their desktop software when they're prescribing or dispensing monitored medicines. The system will issue a pop-up notification to the prescriber or pharmacist during their clinical process, letting them know what information is held within the system. Those notifications will either be green, amber, or red. Green will indicate that there's either no information in the system, or the information in there is only associated with a single prescriber, indicating that there's no requirement to check the system. Amber and red notifications will eventuate when there's information in the system that we think that prescriber or pharmacist needs to see. And red notifications will be there when a certain set of parameters, I guess, are met, which are potential indicators for harm. Probably the most common question we get asked about SafeScript New South Wales is whether or not an alert means that a prescriber or a pharmacist should not prescribe or dispense a medicine. The answer is categorically no. The alerts in SafeScript New South Wales don't instruct your prescriber or pharmacist what they should or shouldn't do. They are merely an indicator of a piece of information that should be considered in the prescribing or dispensing process. The decision about whether to prescribe or dispense medicines remains a clinical judgment decision with your prescriber and pharmacist, as they're best placed to determine what medicines prescribed to you are the safest and best option. And we expect that you, as the consumer, will be involved in that conversation. In terms of the support that we're making available for health practitioners, we've got a couple of different things that we're doing. The first is we're doing education and training. So we have online learning modules which provide information to doctors and pharmacists about what they should, about how to use SafeScript in the context of their care. Firstly, how to access it, how to find it, and how to use it. But importantly, how to incorporate it into their care, into the care they provide. We're also including information in those learning modules around our expectations around clinical autonomy and the fact that SafeScript doesn't direct them on how to practice, that it's only a tool that they should be using. Additionally, we are providing the SafeScript New South Wales clinical advice line in partnership with St Vincent's Health Network to provide a point of care advice service that doctors and pharmacists can call if they're feeling like they need some additional help or they're not quite sure what to do when they receive information from the SafeScript system. So from your perspective as a consumer, if you're sitting with your doctor and they get a notification from SafeScript and they're not quite sure what to do, you can let them know that the SafeScript New South Wales clinical advice line is there and exists to help them through and understand what the alert means and what some options might be. And the information to access the SafeScript New South Wales clinical advice line is available on the SafeScript New South Wales website. It is a clinical advice line for doctors and for pharmacists. It's not a telehealth line, and it's not a line that's available for consumer use. There are a range of other consumer and peer support lines that are available, such as the ones operated by Painaustralia. Our overarching message within the education and training and within the advice line is the primacy and the importance of primary care responsibility, where we are really aware of the pressures and the demand for clinical services in pain, especially, and the barriers that are faced by patients and people looking for pain services. Our focus with the education and training and with the clinical advice line is to provide the support to GPs and pharmacists to keep the care that they provide at their level and avoid specialist referrals unless they're absolutely necessary. What we're trying to achieve there is reducing the referral rates into specialist services and helping to reduce the demand and reduce those barriers. If you'd like support or if you've got questions about your pain or the medicines you're taking or SafeScript New South Wales, there's a few different places you can contact. First and foremost, you can speak to your doctor or your pharmacist. There's Painaustralia's support groups and helplines, which I'm sure you're all familiar with. There's the Agency for Clinical Innovation Pain Management Network. There's information available on their website with information about self-management for pain and other support avenues. And there's also the medicines line, which provides important information and updates about prescription and over-the-counter medicines. If you'd like more information about SafeScript New South Wales, you can contact us either at our website or through our email address, which is safescript@health.nsw.gov.au. We're more than happy to hear from you with your questions and with your feedback at either of those locations. And that's all I've got for you today. Thanks very much for listening in and for taking the time. Thanks very much, Carol.
Thanks, Andrew. That was a pretty thorough presentation. There are a couple of questions in the chat. I'm just wondering if we can perhaps hold off on those questions until the end when we can have a panel discussion, but they're there. We will come back to them. So thank you to those who've already submitted questions. But now I'd like to introduce Dr. Chris Hayes. Chris is a Painaustralia board member. He's a specialist pain medicine physician who works at John Hunter Hospital in Newcastle. He's been the director of the Hunter Integrated Pain Service since its foundation in 1997. His research interests include a whole person approach to pain, outcome measurement, and redesign of health systems to achieve greater integration between specialist pain services and primary care. Thanks, Chris.
Carol, thank you. I'm zooming in, as you've mentioned, from Newcastle, a Wabakal country. I work as a pain specialist at the John Hunter Hospital. I'm sharing a medical perspective this morning, and I would say as a starting comment that I think SafeScript New South Wales is one piece of a more complicated jigsaw puzzle. It's not a universal solution to all the problems that we juggle with respect to chronic pain. And if we expect it to do too much, we can be disappointed. If we're expecting that SafeScript New South Wales is one piece of a broader jigsaw puzzle, then I think we can be grateful that it is doing a good job relating particularly to the issue of safety. And Andrew has already mentioned some issues around patient safety here. From my perspective, I would emphasise that there are across Australia about the same number of deaths from opioid-related problems as there are road traffic crashes each year. So just over 1,000 deaths from car crashes a year in Australia, and just over 1,000 deaths from opioid-related issues across the country. And this is really why government at federal level and state levels have bought in, and SafeScript New South Wales is one of the outworkings of that. So a concern to reduce harm and to reduce the death rate. In addition to that, there are quite a number of problems less serious than death in terms of people presenting to hospital emergency departments or requiring admission to hospital for opioid-related issues. So safety is very much part of what we would think about medically when we're looking at the whole issue of opioid prescribing. And also, as Andrew has mentioned, this isn't just about opioids, this is about a whole range of medications. And from a pain specialist perspective, I think one of the problems that we can see quite commonly is that combinations of different medications, particularly perhaps the opioid group, the morphine group, combined with some sedative medications such as the Valium type drugs, diazepam, benzodiazepines as we call the group, and where those groups of medications are combined, the risk of harms, including death, is higher. So with those background comments, I thought I would just outline a brief patient scenario. This is a made-up patient, but gives you an idea of a common situation and the potential uses of SafeScript in this situation. So let me tell you the story of a 50-year-old person who's moved from Sydney recently to the Lower Hunter region, just west of Newcastle. This person has chronic low back pain, and they've been on opioids for the last 3 or 4 years to treat that back pain. Their doses are a fentanyl patch, fentanyl being one of the morphine group, at a dose of 25 micrograms per hour, combined with endone, a shorter-acting tablet, 5 milligrams 4 times a day. So with that combination, that would bring their total morphine equivalent dose to just over 100 milligrams, which would mean that they do cross one of the thresholds in SafeScript. This opioid medication in the person is also combined with a 5 milligram dose of diazepam or Valium at night. And so in this case situation, the patient would cross 2 thresholds, the combination of the opioid with the benzodiazepine and the opioid dose itself being above 100 milligrams of morphine equivalent. So this person moves to the Lower Hunter region. They find a new GP who is willing to continue prescribing, as well as exploring new management options. And the GP, because it's not mandatory, the GP chooses to sign up for SafeScript New South Wales. They write a prescription for this medication. So they've said to the patient that they are happy to take over the general practice care, including the prescription. So they write the prescription, and what happens then is that an alert, a red alert, pops up on their computer screen in the practice as they are writing the prescription. And so from a consumer perspective, the question arises as to what that red alert means. Andrew has already made the point very well. I think that there is absolutely nothing in a red alert or in the SafeScript system in general that should startle the GP into not prescribing. It just alerts the GP to the fact that there is potential risk to the safety of their patient. And so what happens in this situation is that the GP continues to prescribe. The patient goes to the pharmacy and picks up the medications as prescribed. The pharmacist also gets the red alert and can have discussions about safety with the patient. Now, from my perspective, I hope that there might be two particular consequences of the GP getting that alert, neither of which, as mentioned, is them stopping prescribing in a hurried way, which is often a fear that people talk about with SafeScript. Will SafeScript mean that my GP suddenly stops prescribing? So one of my hopes is that when the GP gets this red alert is that they ring up me or one of my colleagues at Hunter Integrated Pain Service, given that we're the closest public hospital service to the GP. So I'm hoping that SafeScript will encourage communication between GPs in primary care land and pain specialists like myself working in the hospital system. And then my hope is that in that conversation, we can talk about the broad range of options that are available to the patient. My second hope is that that red alert to the GP will encourage them to have a broader discussion with their patient about what are the other alternatives. I think, what we're really wanting from a safety perspective is not that the GP simply continues only down the medication pathway, but that they have a discussion with the person about what are the other options and how might this weave together. And so I'm hopeful, as I say, that in those two outworkings, if the GP is to ring the pain service and the GP is to have the discussion with the patient, what that amounts to over time is that there's a deeper exploration, perhaps, of other management alternatives beyond the opioids. So what does all this mean beyond my little case history? Let me just move on to make another couple of points, and then I'll finish, and we'll be getting the perspective of Kim, one of our consumers, coming up next, leading into the broader questions and answers. I mentioned to begin with that I think if we're looking at SafeScript New South Wales as just one piece of the jigsaw, that will be helpful. I think another very helpful piece of the jigsaw puzzle that is yet to be locked in relates to the review of the Medicare benefits schedule that is currently underway. There have been a number of recommendations made to federal government at this point about access to particularly multidisciplinary or allied health care. This is the role of psychologists, physiotherapists, occupational therapists, dietitians, and so forth in chronic pain. As the system stands at the moment, there is limited access to those services under the MBS, and there has been a proposal put to government to expand that access to allied health services. This is the what else is available beyond just the medication aspects of chronic pain management. So from my perspective, I know Painaustralia are playing a key role in advocating to government about that. I think it is also powerful if individual consumers working alone or as part of other consumer organisations continue to lobby government to consider the reforms that have been proposed to them as part of that MBS review. I think that could be very helpful if the proposals that have been put in place were considered. I'm not thinking that the MBS reforms will totally solve the problem. One of the aspects is that even if they do support more allied health involvement and other issues like group pain management programs, it doesn't solve the issue of gap payments, which are still a considerable problem, I think, to the consumer, that even though an item number may be there for their psychologist to see them to help treat their pain, the amount of reimbursement that's available through the MBS to the psychologist is probably not going to be enough to cover the full fee, so there's still the issue of gap payments to be considered. Anyway, I think that is an important piece of the puzzle that could be looked at in the next phase. The other pieces of the puzzle, I think I mentioned with my little case history story, I think it will be a very helpful piece of the puzzle if we can continue to improve communications between GPs and pain services. I think from my perspective, it will be helpful if we can get really smooth and quick communication between GPs and pain services that may be in the zone of advice. That doesn't necessarily mean the patient needs to come into the pain service. I think there's an advice capability that could be useful there, where there's a discussion between the GP and the pain specialist about safety from a medication perspective. We don't necessarily do this smoothly at the moment, but to get that advice capacity running smoothly, I think would be a very helpful piece of the jigsaw puzzle that sits related to, but separate to the question of whether the patient actually comes in for face-to-face contact with the pain service. And then another piece, a third piece of the jigsaw puzzle that I think will be good for us to, across the sector, continue to emphasise is getting the language right, because I know there's certainly the potential with issues like SafeScript New South Wales and pain management more generally and opioid management for there to be stigmatising language that leaves the patient feeling judged. So I think an important part of this jigsaw puzzle is to continue to develop our non-stigmatising language. We're not wanting to judge people in a negative way for using opioids for chronic non-cancer pain. We're wanting that to be something that is discussed in an open and a non-judgmental way alongside with what are the alternative managements. So yeah, just to summarise, you know, I think SafeScript New South Wales can be an important piece of the jigsaw. I think other important pieces of note at the moment, the MBS review, the communication between GPs and pain services, and the use of non-stigmatising language more generally. I think if we can get that right, SafeScript New South Wales will be a very valuable addition to the pain landscape, and I think it is something that can really help in terms of adding to patient safety and reducing risk of harms. That's all I have to say at the moment. Carol, back to you.
Thanks, Chris. That was really insightful. And I think it's a good note to end on and to ask Kim to join us now, Kim Allgood, who's a member of Painaustralia's Consumer Advisory Group, particularly that question about stigma and the getting the messaging right, which is something that the Consumer Advisory Group has been working very hard with us on, and New South Wales Health around ensuring that the messaging is right for consumers and is not stigmatising, but does, you know, address the issues that are being raised. And certainly to date, that's been, you know, very much on track. So Kim has been working in the not-for-profit sector for over 2 decades. She's presently the secretary of a registered health promotion charity. She's served at executive levels on several community organisations, and she's worked to raise awareness of persistent pain conditions. She's a co-founder of the Purple Bucket Foundation. Kim has taken time out of a busy schedule today to speak about how SafeScript New South Wales may affect consumers who rely on medication to manage chronic pain. So welcome, Kim. Thanks.
Thank you, Carol. And I too would like to recognise that I am on the lands of the Butchulla people up here in Queensland, and pay respects to their ancestors and elders, past, present and emerging. I recognise that the First Nation sovereignty was never ceded, and this continent always was and always will be Aboriginal land. Last night, a current affair demonstrated the severity and yet how simply painkiller dependence and addiction occurs. The recently published Australian Annual Overdose Report 2021 shows the number of deaths accidental overdose in 2019 in New South Wales. Greater Sydney was 327 at 6.1 per 100,000 people, and 220 for the rest of New South Wales. It's 8 per 100,000 people. And those numbers are quite saddening. Not only will SafeScript New South Wales help practitioners, pharmacists and their patients manage their medications safely, the SafeScript New South Wales will promote a better, more open communication is the plan, and hopefully that will work between the practitioners, pharmacists and their patients. Ultimately, the hope is that those numbers will decrease quite soon. And in regards to what Dr. Hayes was saying, in regards to the communication with pain specialists, that would just be a really big piece of the jigsaw puzzle. The communication with pain specialists, neurologists, all specialists would make a huge difference for the chronic pain patients. There needs to be a much more open communication. The language, as Carol was saying, the stigmatization it makes it very, very hard. There's a lot of consumers suffer quite deeply because of the fear they're being labelled of what they're not. And the training that SafeScript is giving to practitioners and pharmacists in regard to that was something that I recognised as being extremely well presented. The social issues that people are facing was recognised in the training, and I thought that was quite incredible. It really hit home for me the way that was pointed out in the training. It was really well done. And if the practitioners and the pharmacists pick up on those things as well as it was delivered, I think that SafeScript will definitely be extremely helpful for the people that need the medications. There's a couple of really important points I'd like for the consumers to remember when it comes to SafeScript. First one is probably really, really important. Your privacy will be protected. It's done in a manner that it's only the people that need to know. So your prescribers and pharmacists, you don't have to worry about somebody else working at New South Wales Health getting something that they're not supposed to get. SafeScript does not instruct your prescriber or your pharmacist what to do. It's not going to say, don't prescribe. SafeScript was designed to create better safety around prescribing high-risk medications. It is there to keep you safe. Doctors and pharmacists are supplied comprehensive training in the use of SafeScript and how to support the needs of their patients. What I was saying a minute ago, it really is comprehensive training. They go through 3 modules or something, if I remember rightly. And again, SafeScript is not about removing your medication. It's about making sure you receive your medication safely, ensuring your pain treatment and management continues in a manner that suits your long-term health and rehabilitation. So basically, in a nutshell, SafeScript is about keeping you safe, and it's what it was designed to do. So after the work that I've done with Painaustralia and with New South Wales Health, I actually think it's definitely going to be much, much for the better than the way that things are working at the moment. And as I said, what a current affair pointed out last night, we definitely need something to make things easier to manage, safer to manage, and to help protect those of us that need the medication. So I'm happy to answer any questions, if that's okay with you, Carol.
Thanks so much for that, Kim. And I will open up the webinar to questions in just a moment. But in closing, I'd just like to thank everyone who's joined us today and the presenters who are here. I just wanted to acknowledge what we have heard today, and it's been an impressive and insightful set of presentations. So in opening questions, we've got quite a few, and I just wanted to, I'll start with, so let's, the first question that has come in, and thanks for your patience, everyone, because I know a number of you have already sent them in while people were speaking. Can ACT clinical staff from a hospital setting get access to New South Wales SafeScript? And that's from Joy Burdock, sorry. Andrew, perhaps you could answer that one for Joy.
Of course, thanks very much, Carol. Thanks, Joy, for the question. So at the moment, no. ACT's clinical staff that only work in the ACT won't be able to access the information in SafeScript New South Wales. Only doctors and pharmacists in New South Wales will be able to access the system. As I mentioned, though, we are working with other states and territory governments on a framework to share information between states and territories so that the systems can share information when required. But under those circumstances, those staff members will be accessing the system in their jurisdiction. And the reason for that is the privacy protections and measures I mentioned around the penalties for unauthorised use and disclosure only extend to practice that occurs in New South Wales. That's as far as those penalties reach. And so for that reason, we won't consider providing access to the system outside of the state.
Thanks, Andrew. Another question from perhaps for you again, Andrew, this one. What has been the experience overseas with prescription monitoring programs of this type?
Thanks, Carol. I get the sense that maybe most of this is going to be for me. I think it's fair to say the experience with prescription monitoring programs overseas is mixed. They're not new by any stretch of the imagination. I think there's probably history that dates back at least a couple of decades in some states in the United States. But I think there's been a resurgence or a surge in the last decade, and in particular the last 5 years. I think, as I said, that the experience is mixed. There have been some instances which have shown really promising results, which have shown reductions in total amounts of opiate being prescribed, total number of patients being prescribed, medicines, total numbers of prescribers for patients reducing, so increasing the therapeutic relationship between a consumer and a single prescriber. So some really good measures that we're certainly interested in seeing in New South Wales. I think there's also been some negatives that have been observed, and principally in environments where the system isn't well supported by a permissive regulatory regime. And so the things that we have sort of seen that are indicative of where people get pushed into the illicit market for opiates and other monitored medicines is where there's a really strong regulatory regime around penalties for prescribers and pharmacists for not using the systems, or for penalties for continuing, or maybe a compliance or enforcement approach around really targeted at reducing prescribing. That's not New South Wales' approach. New South Wales isn't going to make SafeScript New South Wales mandatory for health practitioners. We're not going to force and monitor and enforce checking of SafeScript New South Wales for doctors and pharmacists. We're really approaching SafeScript New South Wales as a clinical tool, which will help health practitioners make better and smarter and safer decisions. So we're looking to sort of learn from some of the experiences overseas and apply that thinking here. The other thing that we're aware of in terms of systems that provide benefit overseas is ones where the data is complete and available in near real time. So some of the systems that haven't been effective are ones that require data entry by doctors and pharmacists, or that are delayed. And so the design that we have, which is drawing information directly from practice software without requiring any further activity or action by doctors and pharmacists, means the data is complete, and it means that people can trust it. And so we're hoping that learning those lessons from overseas and applying them here, we'll see that the system in New South Wales is safe and effective.
Carol, Chris here. Can I add a comment about overseas systems?
Yes, please.
This is thinking about another piece of the jigsaw, so not so much overseas systems relating to prescription monitoring, but the other jigsaw puzzle piece that I mentioned about communication between GPs and specialist services. So in the UK, the National Health System now has an advice line capacity in place whereby any referral of a patient from the GP to any sort of specialist, not just pain, needs to go through an advice step first. And I think that type of system is quite interesting and could be helpful for us to think in Australia about how we might use that. That system means that the GP and the specialist have a conversation about various things, including medication strategy first, and that happens very early. It doesn't mean there's a long waiting list. And so they have that early discussion about medications and other issues, what tests might the specialist recommend and so forth. And then only once that initial round is complete does the question come up, should the patient actually come in to see the specialist? So that system is easier to implement in the UK, where GPs are block funded for services. It's a little bit more hard to think how that might be implemented in Australia, where the GPs are just funded for face-to-face time with their patient. So at the moment, the Australian system doesn't reward any administration or communication time for the GP to ring a specialist on the patient's behalf. I think that is a problem with the system, because I think that can be a really powerful add-on and bring value to patients' care. But that's just for people to consider as they're thinking about the Australian system. You know, I personally think it would be excellent if there was capacity for the GP to be rewarded for some administration non-patient face-to-face time, if we could be advocating for that. Look, I just think it's a really valuable task that the GP can undertake on the patient's behalf. Doesn't mean that the patient needs to be there for all of it, but very interesting system with some challenges about how we might implement that in Australia. I guess in Australia, we could go for telehealth. Perhaps that's one avenue that is funded, that does involve the patient being there along with the GP and linking to the specialist. So that means all parties need to be on deck, synchronous input happening. So that is one way to do that. That involves the patient. I think there could be other ways to explore.
Thanks, Chris. Will SafeScript database identify doctor shopping and inappropriate prescribing? Andrew?
Carol, I think it probably will. The alerts in the system will trigger where patients are seeing more than 4 doctors for monitor medicines within a 90-day period. And so that's an indicator, and that's a level of prescribing that we know contributes to harm. You know, I mentioned before that the system's been live for a while now. Doctors don't yet have access to it because we're letting the data build up. But what we can see from the data right now is that there are people that see more than 30 prescribers in a 90-day period, and that level of prescribing and that type of behaviour is almost certainly going to be what will be identified by the system, and that I think is indicative of a type of behaviour that is the type of behaviour that we're trying to address with SafeScript New South Wales. I don't think that's the type of behaviour that's indicative of someone with a genuine chronic pain concern that's got a genuine therapeutic relationship with their prescribers, and that's the type of behaviour that I think SafeScript New South Wales will identify and probably reduce.
Brilliant. Thank you.
And Carol, also Chris again, just to chip in, I think you know, there's the patient perspective, how one might perceive that. There's also the medical perspective on that, and I just wanted to add that from a GP or a pain specialist potential prescriber's perspective, we really do want to know as a safety issue if there are a number of other opioid prescribers in the mix, because our current systems don't readily alert us to that. So if I'm seeing someone in the pain clinic, or if the GP is seeing someone in their rooms, the current systems just don't alert us in any even close to real-time way if there are another couple of prescribers in the system, and that is potentially a problem. I think we do want open communication across the system, and medically I do want to know what my medical colleagues are doing, and that's a slightly different angle. I do also want to know what the patient is doing and thinking, but particularly I do want to know what my colleagues in general practice are doing and how many of them are involved in this particular situation. So I think that will be a marked step forward, and way beyond what our current systems can do.
Yeah, thanks, Chris. And Kim, if you do want to provide a perspective, yeah, please do.
I think it's also important for consumers as well. If they're aren't able to get in to see their normal doctor and they see somebody else in a clinic, and that doctor says, okay, well, I think you need to be on this, and then they go back to their other GP and they like, okay, you need to be on this, and then they go and see another clinic because they've moved a different suburb, and their records haven't gone through in time and they start on something else, and those medications don't quite work. There's an issue there. So SafeScript would make that, okay, my records haven't come through, would make that not a problem and stop anything that could go wrong, because medications don't always like to have a party together.
Yeah.
So,
yeah, good point. Thank you.
And Carol, just to add a little bit further, that if it was coming up on the system that a patient had seen 4 or more prescribers in recent times, there is, to my mind, nothing that would be saying in that opioid prescribing should suddenly stop now. That would not be what we would usually be thinking. From a safety perspective, for that patient, we would be trying to get communication between all the doctors that have been involved in care. And my first thought about that, we're trying to get to the point where there is one recognised prescriber of any opioid medication that is happening. And usually we wouldn't be thinking to stop medication, at least in a sudden way. What we would be thinking about is getting one nominated GP to be the main prescriber. Then we would be looking at whether the prescribing stays and continues, at least for a time, in a pain setting, or another option that we sometimes use is changing that to a drug and alcohol system. So in some of these situations, we may think, with discussion with the patient and those involved in their care, that the safest approach would be for the person to come in and under a drug and alcohol system, which could mean that the person is getting access to opioid medication through that system. That could be a daily pickup at a drug and alcohol clinic, or it could mean a bunch of other things, including it might be a monthly injection of long-acting depot buprenorphine is an option that's available now. So they might just need to go into the drug and alcohol clinic on a monthly basis for that long-acting injection, and that may be, in some situations, the safest way to deliver opioids. So just to highlight that there are a number of options to people, and that the medical system wouldn't necessarily judge the patient negatively in that situation. The system would look from a safety perspective about what is happening for this person. Why are they seeking out 4 different prescribers or more? Is there an addiction or a dependence issue, and what is the safe approach in that situation? And just to reinforce with people that, generally speaking, we are absolutely not looking at suddenly stopping opioid prescription for people. We're interested in the broader discussion involving the patient and exploring the options.
Yeah, thanks, Chris. And just going to the question of training, Andrew, will pharmacy assistants be trained? And this person says they've noticed attitude from some serving customers. So a question of stigma, I guess, around that. But is that the case? Are they being trained?
So I can understand the issue and the concern. So the education modules will be accessible to pharmacy technicians. However, I think it's probably fair to say that they're probably not the real target for the type of education that we're providing, which is really in the realm of clinical care and communication. Pharmacy assistants won't be able to access SafeScript New South Wales. So whilst they can access the training, it's not really a system that's intended for their use. The sort of education and training and upskilling of pharmacy assistant staff is really a pharmacy owner and pharmacy manager responsibility, and it's not one that New South Wales Health will be playing too much of a role in. Yeah.
Okay. Is SafeScript New South Wales linked to My Health Record?
It's not.
No.
It shares some of the data will be the same because of the source of the system, the source of the data for SafeScript New South Wales is a similar source to the prescribe and dispense repository within My Health Record. So some of the information will be the same, but the two systems aren't linked. No.
So I guess then the question that is following and is along a similar vein, what happens if I move interstate? Is there data sharing between each state and territory prescription monitoring program?
So yeah, as I mentioned a couple of times now, we have plans in place with other states and territories to enable data sharing, to share information and share records. So under the circumstance where someone moves states, that would be a setting where that would be useful. At the moment, those frameworks aren't in place. The privacy laws and principles that govern information management between each of the different states and territories are quite complex and difficult to unpick and all different. So we're working through that, but it's not something that we're going to rush. There is a question about, there's another one that's related, which is if I'm in New South Wales and I pop into the ACT or vice versa, where will the information be held? And this information is on our website, but the information that will be held in the SafeScript system, in SafeScript New South Wales system, will be anything that's prescribed in New South Wales or dispensed in New South Wales, or prescribed or dispensed in another state or territory where the person is resident in New South Wales, where they have a New South Wales address on the prescription. So if they go into the ACT and they give their address as being in New South Wales, that information will be kept. It'll be in the SafeScript New South Wales system. It will probably also be in the ACT's Canberra script system because it will meet their data requirements, which is another actually challenge in sharing data between states and territories because the records will exist in multiple places.
Yeah. Absolutely. So just a slightly different perspective, Andrew, legal liability of the prescriber. We're asked here if the red alert, if they get a red alert, will they go on to prescribe and then there's an adverse event? What is their legal liability?
So Carol, it's a good question. I'm a pharmacist, not a medical indemnity expert, but what I'd say is that SafeScript alerts don't direct a prescriber what to do. We're intending SafeScript New South Wales to be a clinical tool that a prescriber or a pharmacist uses to support and assist their clinical judgment, but they remain responsible for the decisions that they make, and we're really trying to preserve the professional autonomy that clinicians have. And I guess something that comes along with that is being accountable for the decisions that they make.
And I
Carol,
guess, oh yes, sorry, Chris, yep.
My understanding, the legal perspective relates very much to what is reasonable practice. So, which is not to do with the monitoring or SafeScripts, it's to do with how one's medical colleagues would view a case and a prescribing pattern. So if it is deemed to be reasonable practice, then there is a measure of protection in that. If it's deemed to be not reasonable practice, that is exposing the prescriber to medico-legal risk.
Thank you. I think we're pretty close to time, so we might wrap it up there, but I just want to thank everyone for joining us today, including our presenters, Andrew, Chris and Kim. Again, thank you for your perspectives on SafeScript New South Wales. That gives us further assurance, I think, that this program will go a long way towards making safe and effective medication use a reality. And I hope the information that was presented was useful to you today, and that you were able to get your questions answered. I know there are a few people who still have questions, and we welcome those questions. So if you do, please contact Painaustralia or New South Wales Health have SafeScript at health.newsouthwales.gov.au if you'd like to direct your questions there. Painaustralia will continue to work with New South Wales Health and our consumer advisory group throughout the rollout to ensure that the transition is as smooth as possible for people who rely on medication to manage their chronic pain and other conditions. So we're looking forward to that, and we do hope that you will let us know if you have any further queries. But on that note, I'll wrap up and say thanks.
Carol, thanks very much for taking the time today and having us on to this webinar. I just wanted to, on behalf of the program and New South Wales Health, thank you and all your colleagues at Painaustralia for all the work that you've been doing with us to support the SafeScript New South Wales program. It's something we couldn't do without you, and we're really grateful. And Kim, for your support on the consumer reference group. Thank you.
Thank you.
Thanks, Andrew. Thanks, everyone. Bye for now.